Hi. I have a question and I have a comment. First of all, I thought, I believe it might have been Debbie up there. She had it right on about the, what the addicts go through, and I think she's got a very good handle on what's needed there, working with them, and I appreciate everything that you guys are doing up there. I think you're not getting enough support, and I don't like the dynamic that where you have to beg the federal government for money, and I think it's not working that well. I was wondering, are there any state initiatives or people thinking about doing an initiative where they require drug companies that sell opiates in the state to pay into for drug treatments, and or anything in the legislature? And I lost my best friend in high school earlier this year to heroin overdose, and I appreciate what you're doing there with being able to act quickly and get somebody revived. I also lost another close friend several years ago, and I've had a family member that also was on heroin, so I've had to deal with it quite a bit. And if people are struggling, I'd encourage you guys, you have a family member or what, you got to be tough with them and demand that they don't, just honesty. If they slip up, you got to love them, and just let them keep coming back and keep going back towards them, and keep that going so they can eventually get clean, get past their issues. And then I think everyone needs to think of themselves as Americans, and when you're going to go vote, forget about what party it is, forget about if you like them. You just gotta purge them. You gotta get rid of them, because there's no will to handle this on the federal level. And I think there's one good aspect to this. I believe there's one supplier for heroin, and that's the New World Order. And I really do believe that. I think people got to be honest about things. That's why we went to war in Afghanistan. So I think this is the first year in all of my voting opportunities since I was 18 to vote for an independent that wasn't influenced by the New World Order. So I encourage you guys all to vote and purge all the candidates that don't have the will to.
I just want to make sure we have enough time for some other questions, but you asked an excellent question about legislation, and thank you for sharing. And I'm sorry about your loss. But there has been legislation introduced at the state level to try to put a fee on these opioids. I actually introduced a bill last year to put a fee on opioids and have that money go to our departments of health so they can invest that into programs of naloxone and treatment. I'm going to reintroduce the bill again this year. It's an uphill fight, I think, as Lindsay pointed out. Purdue Pharma, just one of the many, has made billions of dollars off of this. And then just also again to point out what Snohomish County has done here with their drug take-back program, and King County has done with their drug take-back program, which puts a fee on the manufacturers. I'll also be introducing a statewide drug take-back program this coming session. So we can thank, because I agree it's not happening at the federal level, but it's happening at the county level, it's happening at the city level, and hopefully we can get some things happening at the state level as well. But it's an excellent question. Thanks.
Hi, I'm Steph, and I too am a parent of two addicts. One is on the road to recovery, and it's like walking on eggshells, so I can totally understand it. One of my questions is with the new approach that law enforcement has, along with this, is prosecution going to change, or is it going to be on on a by-case basis as far as prosecuting people with drug-related crimes, possession, where they are incarcerated with basically going through a revolving door on the verge of getting help, and then the help gets pulled out from underneath them for whatever various reasons, because there's not enough resources or money or various things. And I just had that question, is prosecution, as far as, kind of locking people into this, where they feel like they're labeled as a career criminal, where there's no hope. That's one of the questions I had. If prosecution is going to change along with this new approach of helping people, and I feel that sometimes I feel like part of just the various agencies, I feel like there's some groups that are very sincere, and then there's other parts of the government and legislation that need to catch up, get rid of the status quo, go along. I just love the idea that the Snohomish County Sheriff Department is being so proactive with it. It's about time, and I really appreciate it. Thank you.
What was your name again?
Steph.
Steph. I'm Lindsay. Thank you for your question. Like I said, I'm not professional, but I work with the courts, and so I can give you some information about this. So law enforcement, unfortunately, doesn't do anything really with the prosecution. It's just their job to enforce the law. So he wouldn't necessarily be able to answer that question, but I can, just because I've worked with so many people who end up in drug court or family drug court. Basically, it depends. Really, it depends on the prosecuting attorney. It depends on the crime. It depends on the individual and how many crimes they've committed prior. It depends on what their willingness is to recover. There are so many recovery advocates that are staff members inside of the court system, especially in Snohomish County, that if one of your children ended up in that court system, it's very likely that they will have the opportunity given to them to opt into drug court. And it's an amazing program, and the judge is a buddy of mine, and he is awesome. If you have a specific situation that you're wondering about that you don't really want to share publicly and you want to talk to me afterwards, I can totally talk to you and guide you through it. I know you're just trying to get a general answer, but it really just depends on the person, the case, the situation. But I can totally help guide you through whatever you want after this is over.
I'm just curious, we're doing a lot of talking about Suboxone and methadone, but what about drug treatment centers and detox?
So if I understand your question correctly, you want to know if there's going to be more opportunities for drug treatment and detox?
Yeah, I mean, we're putting time and energy into it. The pharmaceutical companies making more money. I mean, and yeah, they enforce Suboxone, they offer
So,
She's saying there's more emphasis on medication-assisted treatment than there is on abstinence programs, facilities, stuff like that.
okay, so in those aren't two separate silos. We are working with the behavioral health organization that now oversees the Medicaid-funded treatment. The county fills kind of the gaps on the low-income side of that. So we are working to increase outpatient treatment, abstinence-based, as well as inpatient treatment facilities. All of that isn't separate. We're doing everything we can in all of those arenas to increase capacity. We have a problem with workforce. We don't have enough counselors in the field. Previously, before the BHO came along, it was easier to access treatment in other parts of the state and whatnot. And they're also trying to increase the collaboration between the different behavioral health organizations. So we are really, truly trying to increase all options for treatment.
So if anyone in the room has ever had a cancer or a loved one who has had cancer, you may be aware that there is a wide range of treatments even for the same kind of cancer. There's no one treatment that is necessarily going to work for everyone. applies pretty much to every disease. And addiction is a disease. So for some people, abstinence will work, but let's understand, if you say that abstinence is the only route to sobriety, you are sort of implying that this is a decision that a person can simply make to turn it on and turn it off. It may be that for some people, that it's not that simple. So we have to have a range of options that are available to accommodate the range of needs in the community.
We have a question back here.
Hi, I'm Robert McCullough. I work for Recovery Recovery Centers, Program Manager at Outpatient here in Linwood. One of the issues, I guess this is a legislative question, that I bump into with a lot of patients is we get them a treatment, get them sober, heroin addicts, alcoholics, meth addicts, you know. We give them a voucher through the county, through the recovery support program, to get housing, because physical needs are important. They need housing, they need employment, but many of them have felonies. And they get dead-end signs everywhere, almost everywhere they go. Not only they cannot use the voucher, they can't even get a job at McDonald's. So I just wonder if there's anything being done about that, because they're grateful to be sober for once in their life, and they get a voucher for rent through the county, and they can't even use it because they have a felony.
My name's Lindsay. I'm sure you know that by now. I've said it a couple times. If you look behind you, there's a guy in a hat and with a Bluetooth in his ear. He can help you. His name is Robert Smiley. Mark. Yeah. So Robert has a ton of resources for people who have criminal history, including felonies, and he works with people that get vouchers like through Access to Recovery and stuff like that. And he is my go-to for questions like that. There, like I have said before, like when in my little spiel, the government is not going to do anything like that on a state or federal level. It's just not going to happen. It's going to be like you're going to have to do a lot of networking, a lot of making phone calls, a lot of asking questions to find people who are willing to help those who are struggling in those areas. And Robert is somebody that I know for a fact has been able to do that. So I would definitely talk to him.
And I'll just say on the legislative side, we have had some attempts to ban the box, which is to take that box off of the employment application as to whether or not you've committed a felony, also to try to lower some of those barriers for housing. We haven't been successful. We'll try again. I know these bills will be introduced again this coming session. But right now it's kind of outside resources. And I think the overarching thing is changing that stigma again. So when people see that, you know, there's a drug conviction or even a felony conviction, that we can't just shun that person. So that's all of us, but there's a lot of legislative work to be done too. And I think we have time maybe for one or two more.
This is just a really simple question about the naloxone. I've just recently taken over a youth program where we have a teen drop-in center just down the street from Snohomish High School. And I didn't even know about naloxone until I came here tonight, which is really sad. I apologize, but I'm learning. Is there a different route for getting it as a private citizen, or if I'm running a program that's a part of a 501(c)(3), is there like, can you get more doses and have them stored on property? Because we do have a lot of homeless youth that are using right around our building, and I would really like to be able, I just don't know that much about, and I notice there's also no pharmacies in Snohomish proper that are shown on this list, but I can pretty much, I'm assuming I can get it anywhere in the county. Can I get
So that's a couple of questions, so I'm going to try my best to capture them all, and if not, I'll talk with you after. Okay, so as far as the pharmacies in Snohomish County, those are the pharmacies that carry naloxone and have the understanding with Dr. Goldbaum. Is there a difference between a private person getting it versus a program? Perhaps. You know, an individual can go to that pharmacy and get that. Can a person get it for a cheaper price if they buy it more in bulk? Again, that's a perhaps. But one of the things I'll tell you is that doctors now, I think it was July of 2015, that an RCW came into play where that doctors can provide a standing order to an entity. And so that is one way that a standing order to an entity. So like Dr. Cartman gave one to Snohomish County Human Services so that we could purchase naloxone, store naloxone, and dispense naloxone. And as far as your program, can you talk to me afterwards for more specifics? Okay?
Well, I guess my question concerns about going and looking for those that are not really seriously addicted to heroin. I listened to Linwood, I forgot your name is there, but going out to those that are kind of at the beginning of addiction and trying to get them into recovery. And I also heard that same message when Governor Inslee wrote the executive order that he was going to work towards decreasing the opiate prescriptions, and the other thing was expanding treatment. That was on the news just recently, and the prosecuting attorney for Pierce County stated that he also wants to go and invest more money into those that are in the early signs of addiction. But what about those that come through the court system that are there for possession of drug paraphernalia? You know, those are the ones that are starting in the criminal system. And my concern really is that you go after those that are just starting. It's my understanding that in order to conquer addiction, they have to hit bottom. I would think that those that are starting in with the drug paraphernalia in the court system would be heading towards that bottom and in need of more services and more assistance than those that haven't even really gotten into the system yet, if you understand what I mean. So, it's like, what about those that are already out there that need help? You know, drug paraphernalia, it seems that the programs need to be catered towards those people rather than those that have not gone past that threshold and entered into the court system.
So is your question, are you asking if there's some sort of advocacy for people who have not yet entered the court system but maybe will?
No, I heard tonight that we're looking at programs to go, you were the one that said it, that you're going to go and try to reach out to those people that are at the beginnings of addiction. You know, go out and work with those and try to get them help.
Not necessarily are they at the beginnings of addiction, but it's having those conversations on a daily basis, asking, are they ready to get help? Because a lot of people, they'll have candid conversations with us, even in uniform. We'll say, are you ready? Are you ready to get help? And sometimes they'll say, no, I'm not ready yet. If you have somebody who's you're arresting for being in possession of drug paraphernalia, if they have needles on them, if they have pieces of foil with snail trails, those are all things that are indicative of someone who's in the throes of addiction, especially if they're not managing their habit well enough, their addiction well enough, where they're actually being caught by law enforcement, or we're catching them right after the fact. What we are looking to do is get those people tied in with another pre-arrest diversion program where we can get them tied in. They go right to a community service type of setting. They have a couple days where they're out actually, similar to what Everett has going right now. They'd be out working, doing community service during the lunch times that would be provided by the city. We would have them, again, interacting with an embedded social worker who would be trying to work with them and tie them into services. This is all pre-getting them connected with the criminal justice system. That's something an officer can make the call of at the time while they're out dealing with this person.
But it seems that the attention should be focused on those who have already entered into the criminal system. You know, helping those that are in there with the possession of drug paraphernalia, because you know, it's just once they enter the system, it's like they're captured into it. They go before Judge Moore and he has no mercy whatsoever.
Right. And we could have a discussion afterwards. Judge Moore's pretty reasonable. And again, for drug paraphernalia, that's a fairly minor charge. The chance of somebody actually ever seeing a day in jail for simply possession of drug paraphernalia on their first or second charge, not very high. So unless they have a lot of other co-occurring type things going on. So, and we can talk afterwards, so if you'd like.
I'd like to just extend that a little bit, because the conversation about where we should intervene, there is a particularly vulnerable moment for a lot of folks, and it really doesn't matter how far along you are in addiction. People can overdose with their first dose, and they can overdose after they've been using heroin or other opioids for years. We're trying to begin a program here in Snohomish County, something similar to what has already started in Clallam County, with reporting of overdoses to public health, so that we can contact people who have overdosed. Because someone who has overdosed may be right at that moment where they would consider treatment. So it doesn't matter how early or late in the addiction, but at least with an overdose, that is a moment where we think that there is real opportunity to have that conversation.
There really isn't like a specific area that needs the most focus. Like pretty much every age from 11 on really needs focus, but especially like 11 to 13. That age group is so vulnerable, and that's when kids start cutting and start experimenting with drugs, and that's why I am trying to get into the middle schools to do assemblies and stuff like that to bring awareness to help these kids. I have a 13-year-old girl that started coming to my support group a year ago, and now she leads it like with adults in the support group, and that's the kind of stuff that we need. Is we really need to focus on like the preventative maintenance, but there really isn't one specific area or age group or status or criminal history like that needs to be pinpointed. It's really all of it. That's why this thing is so complicated and challenging, and why people are dying all the time.
I am getting a high sign to wrap this up, and I know there are a lot of questions. This conversation is just starting, not only here in this room, but out in the community, state level, county level. But one thing I would like to kind of say in closing, and Lindsay touched on it by getting out to vote, but also talk to your elected officials. Call my office. Call Adrian if you live in Edmonds. Call Stephanie Wright if you're in the county. Talk to those elected officials that care about this. Well, especially talk to those that maybe don't care about it. But find your advocate on your city council and on your county council and your state government, because that's how we can make a difference. I don't know how we're going to get this done on a federal level, as somebody pointed out earlier. And you know, talk to the cop on the beat. Talk to some of these incredible organizations that have started, and talk to your family and talk to your friends and neighbors. This epidemic is everywhere. It is affecting every family in our community. I think, as we can see by the turnout here on this, stormy night. So again, another big round of applause for the panel. And also, we'd really like to thank Edmonds Community College. Again, Dr. Jean Hernandez was in here and she snuck out before I could embarrass her. But they offered up this space when Snohomish County started talking about this. Another great resource for our community. And thank you all again for coming, for sharing, for asking questions. We'll be milling around. If you have some questions, please don't hesitate. And
a reminder that in about 2 minutes, we'll start in a naloxone training. It'll take about 15 or 20 minutes. So for those that are interested, head towards Clean Spring.